When you first bring your pet home from the hospital after their knee surgery, there are going to be some things that you want to do to help get them to start using their leg, as well as address discomfort and pain. One of those things is going to be icing their knee. You want to do this ideally 3 times a day for at least this first 72 hours. And you can just put a thin paper towel over an ice pack or a pack of frozen vegetables, and you are going to place that directly over their knee. It does not have to be on the inside of the knee, it just needs to be on the knee itself. And you're just going to place that, and ideally you'll want to ice for 15 to 20 minutes. Again, 3 times a day for at least the first 72 hours. You can always do that longer if they still have swelling after 72 hours. Another exercise you can do is going to be passive range of motion. You'll want to start this the day that they come home. If they're still a little bit uncomfortable or groggy, you can start this the following day, but it is something that you want to start ideally the day that they come home from the hospital. I find it easiest to sit along their back, especially if you have a little bit of a wiggly dog. This can kind of give you a little bit more control of keeping them in this position. However, we do not want to force any exercises on your pet. So if they are really fighting you, please do not perform this. This dog is obviously very comfortable in this position, but you can try this when your pet is already calm, maybe already semi in this position, or if your pet has been sent home on trazodone, you can try this an hour or 2 after they've been given a dose of trazodone. You're going to want to support the limb fully and place a hand at each joint. One at the ankle and one at the knee, and make sure that you keep their knee in line with their body so that we're not turning their knee outward or putting it in any unnatural positions. You're going to then gently flex the knee and then extend the foot forward and come back around, just mimicking the natural movement their limb would make while they are walking. And you're going to repeat this for 10 repetitions, and you can perform this 2 to 3 times a day. Another exercise you can do at home with your pet, especially if they are not using their limb and keeping it contracted up, is a hip shift or a hip sway exercise. For this, you want to have your pet stand on a stable surface and face away from you. And you are going to place your hands on either side of their hips, and you're going to gently rock from left to right, and then front to back. Up, Ginger. You can do this for 5 minutes, 2 to 3 times a day. Again, the purpose of this is for your pet to put their limb down and extend it fully to the ground. And again, you can do this for 5 minutes, 2 to 3 times a day. Good girl. Sit.